Okay, this video is just to let you know the high-fat phonies are trying to cancel me. They're trying to make this big push saying that, oh, I made an inappropriate metaphor because I said the mechanism of dementia is like slavery, and that's exactly what it is. It is like torturing a slave. It's a completely appropriate metaphor to explain what happens to a brain cell, okay? You know, it's like we're not allowed to make a metaphor. No, it exactly explains it. That's why I said it, okay? And, you know, this is a routine thing I've seen that happens. They know they can't challenge me about what I'm teaching the pros about how to stay healthy and prevent disease, so they try to slander me. It's the same like nonsense as Chef AJ. They said, oh, you know, because I talked about Kempner having a harem. Big deal. Everybody knew about that. McDougal joked about it before. Chef AJ knew all about it. Okay, that's well-known information. But all of a sudden, I'm inappropriate. Okay, BS. It was because I mentioned the fact that the high-fat phonies, you know, recommending a moderate fat diet is not the same as a low fat vegan diet, and it's a way to erase the legacy of Dr. McDougal, and that's the truth, okay? And then now the other thing too is, you've heard the story. I got kicked out of the university near where I live. I'm not allowed to lecture to the medical students because I was called a patriarchal misogynist because I made a joke about colonoscopy fecal transplant. Basically, a fecal transplant for somebody with leaky gut, like a wife can take her husband's feces, they put it into a smoothie, and they inject it up her rectum into her colon to replace her bacteria flora in her colon, all right? And they can bill for that, of course. It's like injecting a slurry milkshake of the husband's feces. And I had joked. I said, why doesn't she just kiss her husband's ass and take a little shit from him? It's just a joke, okay? Not a big deal, all right? Anybody could have made that joke. It's just a joke, all right? But, oh, no, I'm a patriarchal misogynist because I made a joke about a fecal colonoscopy transplant, all right? And that's the kind of stuff that's happening to try to stop me from telling the pros the truth. They don't want me teaching the medical students the truth. And the person who did that is because I had written a paper about her field and what a joke it was, and how all these medications are well known, clearly known from long-term follow-up not to work, okay? So, you know, that's my punishment for telling the truth about that. I'm a patriarchal misogynist, okay? And now, you know, by the way, I'm half Irish. The Irish have been pretty much slaves for the British for over 1,000 years, all right? Currently, the people of Ireland are being, cited, okay? They've opened up their, their borders, and they flood the country in with people who hate them to beat the crap out of them and destroy them and push them into slavery, okay? And that was the goal of what was trying to be done to the US of A up until the last couple months, and now it's turned around. Hopefully that it'll be permanently prevented, but the long-term goal, slavery is something we should be talking about every single day, okay? Because that's the net tendency in all cultures, is to push towards it. And the only things that prevent it is the people caring about having the right to speak freely and free speech, okay? Them caring about the right to have a you-know-what down south, a you-know-what border, okay? You have to have those things or you don't have freedom, all right? Okay, and what did I say about a neuron that they're making such a fuss about? I said what's obviously true. Number one, you have a baseline high metabolic rate of a neuron, okay? And neurons have a very high metabolic rate, all right? Then you have an oxygen and glucose delivery system, and you have to keep those supply and demand equal. But if you increase the neuron's metabolic rate through psychological stress, sleep deprivation does the same thing, caffeine does the same thing, glyphosate's an excitotoxin, increasing the neuron's metabolic rate, it activates the NMDA receptor. Okay, other things will do that as well. Aspartame will do that, beta amyloid protein will do that, amphetamines like these attention deficit medications will do that. All of those things are increase the metabolic rate. Nicotine, the sulfites in vinegar can do that. You're increasing the metabolic rate. If this gap gets too wide, the neurons will die due to apoptosis. Then if you eat a high-fat meal, that drops oxygen and glucose delivery some more. Vasoconstrictors from dietary sodium, okay, like a pizza. Okay, and then if you also have caffeine, that also drops blood flow to the frontal lobes a significant amount. Okay, so now this gap's getting wider, predisposing those brain cells to die. And what I had said, it's as if you had a slave and you told the slave, run faster, okay? And then you said, okay, now I'm not going to feed you anymore, and you starve them, okay? That's what people do to their brain cells by dropping oxygen glucose delivery and telling the brain cell it has to work faster. And then simultaneously, to add insult to injury, people routinely expose themselves to 5, 10, even 15 or 20 mitochondrial inhibitors, decreasing the ability of the cell to produce energy. So now I said that's like telling a slave to run faster and whipping them in the legs, okay? Believe me, I know a lot about slavery. I've studied extensively the ancient Greeks, the ancient Romans. This has been a problem all throughout history, all right? All right. So anyways, what I'm saying is that's the exact metaphor of what a person does to their brain cell. They tell it work faster, then they starve it, and then they take away its ability to produce energy. Like that's equivalent of injuring the legs and telling somebody to run. Okay, it's in a completely exactly appropriate metaphor. And my metaphor tells you how to protect your brain. Okay, the supply and demand theory of dementia by Peter Rogers, MD. It's the best theory of dementia. That and the dilatory, vascular hypothesis of dementia, the mouse equivalent theory. Yamashima's is decent, but all you need to know for Yamashima is don't eat omega-6 cooking oils. All you need to know from Douglas Kells is, prevent leaky gut. The idea of the neuroinflammation theory of bacterial endotoxins getting access simultaneously, leaky gut, leaky blood-brain barrier due to lack of dietary fiber or other things that are toxic to the gut wall or things that prevent the production of butyrate from the good bacteria in the gut. So anyways, also, if you want, you could send me your emails. If you want, you can email me, and that way I have your email, because if I get kicked off YouTube, I'm just going to go to all the other video channels. So I'd like to stay on YouTube, but if they kick me off, I'm going to go to the other YouTube channel. I'm going to go to the other video channels. And then, so if I have your email, I'll send you an email, when I'm there. So we'll see what happens. I don't know what's going to happen, but it's the punishment you get for telling the truth, okay? They know that I'm right. All the doctors come and tell me what a genius I am and how I've rewritten all their textbooks, and they're so grateful to me. I give them a chance to help their patients, even though the patients don't want to listen, over 95% of them. But I'm just letting you know there's a big movement afoot from the high-fat phonies and some others of that ilk, and who knows who the rest of them are coming from, Big Pharma or something, trying to shut me up. They don't want me teaching you guys the truth about health. So anyways, that's where it's at.